Familia. What a pleasure to have you in this amazing day. We continue to celebrate this week, the week of healthcare centers that are serving our community. As part of the things that we have been talking this week is that it's not just a simple thing. Health doesn't know boundaries. And let me share with you that me as a physician, and if you give me all the money on the world, I can actually reach around 20% of all your health. The other 80% depends on something that we call social determinants of health. They go above and beyond our four walls in hospitals, clinics, tests, medications, and everything else. And that's why it's so important actually to bring partners and make sure that we are helping the wellness of our community to continue. As of that, I'm going to invite someone that it's amazing, has been actually going out there on the community, that it's part of something called Both ER, and I'm going to bring him in. Marcos, welcome. How are you?
Thank you so much, Dr. Shapiro. I'm doing amazing. Thank you so much for giving us the opportunity to come speak a little bit more about civic engagement and health today.
I'm going to actually partner up right now here.
Awesome.
First of all, what do you do there? What do you do in Both ER? What's Both ER?
Yeah, of course. So I guess a little bit more about me. So my name is Marcos. I'm the partnerships manager, and I guess a little bit more about my background. So I just recently graduated with my bachelor's in public health, actually. And through just my experiences, I just slowly came into the civic engagement space. And what I've quickly learned about through school and through just my relationship with VODR now is how important it is to participate civically, as it has a huge impact on the health outcomes of myself, but also the patients and communities I help grow. A great thing about VODR is that we're a nonprofit that's nonpartisan, really just focusing on giving patients that opportunity to register to vote. So we partner a lot with hospitals, clinics, community health centers to help them help their patients achieve their best possible health.
That's an amazing thing because, a lot of times me as a physician, I get frustrated on the whole process. Then why is it essential to actually have healthcare providers and healthcare teams, dentists, psychologists to actually get civically engaged with this?
Yeah, absolutely. That's an excellent question. I think a really important aspect to just recognize is that healthcare professionals are really this trusted messenger and have that unique opportunity to have that super close-knit relationship with patients. So these patients are quite literally trusting their lives, safety, and health in the hands of health professionals. And I think a question that I really want our listeners to ask themselves is, how different would my patients' community look like if they had the opportunity to vote? And it's likely different in so many ways, but most importantly, it'd be that they'd have better health outcomes. A really important piece of research, I think, to mention is by this organization called Healthy Democracy, Healthy People. And they were actually able to look at that association between civic engagement and health. And what they were able to see across the entire United States is that states that were more civically engaged and had more opportunities to vote had communities that were actually healthier. So this is just really a great position for health professionals to be in, to just truly give their patients an opportunity to grow within their communities, but also in their health.
That's amazing, Marcos. And you mentioned something, and it sounds like equity. Then what is health equity?
Right. So health equity is really just about achieving every opportunity to attain the best health one can achieve. So really not thinking about and letting those disadvantages, whether it be any social circumstance, such as economic ones, or really just any social circumstance, prevent them from achieving that best possible health. We see health inequities reflected in so many ways across healthcare, just looking at several health indicators, for example. So thinking about those rates of disease, disability, and death affecting communities in so many different ways. I think it's really important to also just connect this to the cycle of health and how that connects to civic engagement. So when people don't vote or have that opportunity to vote, They're labeled as unlikely voters, and campaigns are actually less likely to address their needs, ultimately resulting in those leading negative health impacts. So really, if we could give the opportunity to have patients attain their full potential by ensuring that their voice is heard, we could really create a more equitable future for them.
Oh, that's just amazing, and actually brings a lot of feeling that a lot of the times we feel powerless as community members. We see all this noise around us, and a lot of times we have the feeling that why vote if it's not going to make change anything. But one of the things that I was reading was that it's quite interesting how local elections, the things that happen in your neighborhood, are the ones that are more valuable for you. And most of the times, because they have such a low turn on voting, a lot of those decisions are just a miracle thing. It's not. It's a maybe it passes because nobody actually turned on it. They went there. And then we have a lot of issues. Then I agree with you that we need to start voicing out our feelings. And I give the example a lot of the times that it doesn't matter if you vote for the purple one or the gray one. It doesn't matter. But if we're not on the table, we're the main dish. Then that's kind of where we are with that part. Then I'm a physician, and I have a lot of healthcare friends, nurses, dentists, nurse practitioners, physician assistants, different scales, MAs, everybody. What can healthcare providers do to help patients be engaged in the voting process?
Yeah, that's an absolutely great question. Before I dive a little bit deeper into what we can do as health professionals, I first just want to preface that voter registration is something that can be done in the healthcare space. The most important aspect to the work that we do, and for people that want to do the work with us, is that we stay nonpartisan. And that's just all to stay in line with all those legal frameworks that help us support that work. But more into the opportunities. So a lot of our opportunities revolve around civic engagement and helping you learn about the different types of skills and resources that you need to help give your patients a voice. So if you're really interested in learning more about that connection between civic engagement and health, and just want to get a taste for what civic engagement can look like in the healthcare space, I absolutely recommend you to join our conference, actually this upcoming weekend, August 12th and 13th. And you can actually find that on our website at vot-eur.org. And if you navigate to the programs section, and underneath, you'll find the conference page. First one, I think. Awesome. You'll find our Civic Health Conference, and it's a virtual free conference with the caveat that you can earn 7 civic, community, sorry, I'm blanking here. Thank you. If you could scroll down right there, continuing education credits. Thank you so much. For only the price of $40. We're going to have some incredible healthcare and democracy leaders, such as Dr. Mona Tisha on day 2, closing us out, and even Daniel Dawes. So really just a great opportunity to learn about the connection and just truly learn how to do the work. Secondly, you can order a super cool badge like this one that we have right here. So this makes it super easy for your patients to sign up to votes. It's as simple as scanning this QR code or even texting this number and code to this phone number right here. It's a great resource for patients as it's state specific. So it guides them through the civic engagement and voter registration process within their state. And as you can see, Dr. Shapiro has put it up on the screen. The resource is completely free and available to any type of health professional, and it'll come to you with the super cool lanyard, and just make sure to wear it around whatever healthcare space you're in. Thirdly, go ahead.
I love this because I have mine, and it's a great conversation starter. A lot of times we have we talk with patients regarding very difficult conversations, sex life, depression, anxiety, suicidal thoughts. Then we have, have you been a victim of violence? And we have a lot of things that we actually cherish. And sometimes as healthcare providers, we feel that voting it's weird. It's a different thing. But on reality, it's an easy topic comparing to like suicidal thoughts, depression, anxiety, cancer, all the other stuff. Then that's why I'm a complete believer with this part.
Awesome. Yeah, we absolutely love that you support us, Dr. Shapiro. I think another really cool resource for if you're a healthcare administrator is that we have Civic Health Month. So Civic Health Month is all about dedicating the nation's media attention and spotlight on civic engagement. So there's 3 goals to Civic Health Month. The first is to drive voter registration. Secondly is to increase awareness about upcoming elections. And thirdly is just to amplify the civic voice in healthcare. It's really important that we talk about this connection, like Dr. Shapiro just mentioned, as it truly impacts all our patients and ourselves every day. And by doing so, we can hopefully build a healthier democracy.
Amen for that. Amen for that. And right now we're almost on the last couple of minutes. We know that life is hard, and we have a lot of families that have mixed status, and some of them actually, are not able to vote. How would you engage those family members?
Yeah, of course, that's a great question. I think we can look at this from 2 different perspectives. The first being from like a clinic-wide or hospital-wide perspective. So it's really important that we, in this scenario, make voter registration less intrusive. So by putting up resources like our posters across spaces, patients might see those posters and take the opportunity and initiative to share it with their family or friends that can vote. And hopefully by mentioning that, they can help themselves and their families also have their voices amplified across the nation. These resources are also available on our website, bot-er.org. And secondly, I think another important way to look at it is that health professionals who probably have this really strong relationship with their patient or have a scenario where they're asked about this voter registration issue, professionals can actually take the opportunity to still share the same resources that are available, such as the QR code, those posters. But the twist is that you share that information, but in turn have them share those resources with their family or friends to, again, just really make sure that everyone's voices are heard. I think it's important to know that just like health professionals, people who can't vote can be just a trusted messenger as well.
That's actually amazing, and I was showcasing right now the website, and it's amazing. I started doing it a couple of years back, and it takes a couple of minutes. It's one or 2 minutes, and it's that part. And the beautiful part is that I don't need to be a expert on civic engagement. I just need this and the empowerment of how to start a conversation, and most importantly, send them here. And I saw that the information it's in different ways, and it's very easy to understand, and it's very welcoming for our community when they know that apart from walking, exercising, and eating well, they can actually be represented and their voices being heard. Marcos, any last remarks, anything else that you want to share with the community?
Yeah, of course. I love that you mentioned how it's super simple to use our resources. Other ways that we make it really easy for you. So on our webpage, under the resources tab, you'll also find scripts that you can use to engage people in civic engagement. And I think it's another important thing to note is that some of our resources are actually also available in Spanish. So that's something that we've been trying to implement within these different healthcare spaces. And this super cool new thing that's actually, I think, released within the last few weeks. So my badge isn't bilingual, but we're actually having bilingual badges being sent out as well now. So that's another really cool resource to just think about if you want to engage your patients.
I'm ready for those completely, and I know that it's going to be very welcome in the community. Thank you so much, Marcos, for being here. Bot-er, always present. And thank you for being a partner with us in our community, because if we don't create partnerships outside of the 4 walls of clinics and hospitals, we're missing 80% of our health. And thank you so much. And we'll see you there. Let's continue voting and stuff. Familia, well, we had Body R with Marcos right now, and it's extremely important that you understand the power that you have in your hands. We all can make a difference, and of course, remember, please, that we want to be on the table, and it doesn't matter what's what if you want to vote for the gray one, the purple one. It doesn't matter. The important thing right now is to make sure that we're represented, because every time that we are represented, the resources that our schools need, our kids need, the streets, the entire social healthcare system that we deserve, it's at stake if we're not there. Then importantly, join us, and remember, please, 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 to continue vaccinating against fear with a dose of truth. Adios, familia.